First, to a very worrying story for any of you whose loved ones are in hospital. And that's because dozens of young Brits are boasting about helping relatives pass nursing degrees and other healthcare qualifications. Well, I'm now joined in our Westminster studio by GBNews reporter Charlie Peters, who's got a superb exclusive on this. Charlie, always a pleasure to have you in the studio. It's bad enough at your time of need when your family members are in hospital, but the revelation that those treating them might have bogus qualification, that chills you to the bone.
And that's only the dozens that have been foolish enough to admit it online, that they have been supporting their parents in getting that qualification. What we saw this week earlier, it didn't take much digging. People were posting on social media and boasting about the fact that they'd been doing coursework, essays, and supporting multiple family members in their processes for getting degrees or qualifications, particularly surrounding nursing and other healthcare qualifications. Some said that they'd been paid by other relatives in the family, not just their mother or their father, but aunties. We saw one person who I replied to, who swiftly deleted their entire social media presence, say that they'd even been paid by up to 5 family members to do this sort of work. They said their names should be on that certificate. And as that discussion went on, it also moved on to other social media platforms. We also saw a discussion on TikTok. And just to give our viewers and our listeners a flavour of what that is, we've got a clip we can play now.
I saw a TikTok of the man in question doing his mum's uni work. You guys are out here doing, and you guys, because I read through the comments, you guys are out here doing your parents' work. Someone said, yeah, I was a mental health nurse by 16. They must really just think we're just some sort of robot. When they had us, they thought, yep, no, I've just got help for life. I get favours. Your parents have you doing degrees for them.
A mental health nurse at 16. It's quite an extraordinary admission. And so when I shared some of this information with doctors working in the NHS now, they had some pretty stern words to say. One said that this could be jeopardising lives in the system. They were stunned to see the open boasting and admission of the process. They also said, what kind of processes could these people be faking? How are they having their qualifications supported by their children? They also asked, could it be a sepsis process? Could they be focusing more on the application of drugs by intravenous means? They didn't know what on earth was going on. They didn't know how to make sense of it. One doctor also told me that there are some confusing scenarios they'd witnessed while working on wards in London, but by virtue of seeing this widespread conversation online about kids supporting their parents' nursing degrees, they said suddenly those errors and those strange scenarios started to make more sense. When I raised this with the Nursing and Midwifery Council, they said they weren't formally aware of any process like the one that we'd raised. But with so many complaints, it seems almost certain that this is a widespread issue.
So to be absolutely clear, this is people within Britain doing qualifications within Britain for relatives who would have no qualifications or no chance of passing those qualifications. Is it also happening in countries abroad, people faking it to get in? Because I saw an alarming thread from a Ghanaian expert I contacted who said this is actually happening within Ghana and other African nations itself. So the qualifications there being sat by other people, getting visas to come into Britain from abroad without even having a qualification at all.
Well, the health and social care visa has come under pretty significant criticism in the last year with that record net migration figure that we saw last year. The Department of Health and Social Care reportedly only expected a handful of people to come in on that scheme, and the numbers really exploded beyond their predictions. There has also been some analysis now which has led to the government reducing the ability of dependents arriving on that scheme to arrive in Britain. That's expected to reduce it. But at the same time, the Nursing and Midwifery Council, they're currently investigating some 700 nurses already in the system on allegations that they fraudulently acquired their qualifications in Nigeria, and they had proxies sitting and taking that test. A former head of that college, of the Royal College of Nurses, did say that this could also be putting lives at risk, and you couldn't have nurses under investigation working on hospital wards. So clearly a big discussion at the moment more widely about the issue of qualifications, how they're acquired, and also, crucially, how they are linked to immigration.
And Charlie, we also hear about care visas being given out to people from abroad coming to care homes that don't exist, or care homes giving out many thousands of visas when they clearly don't have the capacity to employ anywhere near that number.
And this has generated, as we reported last week on the GBNews website, quite an extraordinary explosion in the number of people advertising overseas, particularly in Bangladesh and in northern India, as we found. Advertising that as a route into Britain. Easy, they say, and your entire family can come with you.
Superb stuff. A cracking exclusive. Charlie Peters, great stuff. Keep digging.